How does the AVD work? The way the device works is blood flows from a patient's artery through the device and back into a vein. Once blood is in the device, nanostructures trap, crack, and release the broken pieces of the virus back into the blood. This should not be thought of as a filter. It does not add or remove anything from the blood. Basically, the AVD applies blunt force trauma at the nanoscale to damage viruses, exploiting the inherent weakness of the outer shell. This works because the virus capsid has limited strength, and the capsid is the outer shell of the virus. The capsid's strength is limited because it needs to be. If the capsid were too strong, then the genetic material inside would not be able to get out once it gets inside of a new cell. If the capsid were too weak, it would not be able to survive the journey once it leaves the infected cell and moves on to the next cell. This is a non-traditional approach. The traditional medical approach is to attack the virus with the use of drugs that binds elements and molecules together to block chemical mechanisms that the virus depends upon. In the simplest terms, the AVD uses geometry rather than chemistry. This method allows for a greater range of infections to be treated without having to make new ones for each individual infection. Any virus in the blood that is roughly between the size of 50 nanometers and 350 nanometers can be treated. Thus, any person or animal with sufficient blood volume and pressure could use this for the treatment of viral infections. While having the advantage of being able to treat multiple viral infections in both humans and animals, it has the limitation that it cannot treat anything outside of the bloodstream. Therefore, the immune system would still be necessary to completely clear any infection outside of the bloodstream. For people with compromised immune systems or the very young or elderly, this type of treatment would increase the odds of survival by relieving part of the workload from the immune system and limiting the infection's ability to propagate through the bloodstream. This should not be thought of as a cure for anything, but rather a treatment for many things. This should also not be thought of as a replacement for vaccines and antiviral drugs. Vaccines and the AVD work inversely from each other. Vaccines are only useful before someone is exposed to a virus, and the AVD is only useful after someone is exposed to a virus. Antiviral drugs, on the other hand, can be used at the same time as the AVD. Antiviral drugs can attack the virus inside of cells, while the AVD attacks viruses outside of cells and in the bloodstream. The simplest way to describe the difference between the two treatments is with antivirals, the treatment moves to the infection. With the AVD, the infection moves to the treatment. The treatment procedure is similar to donating blood and thus has the same precautions that need to be followed when administering the treatment. It starts with the medic inserting one of the AVD hypodermic needles into a vacutainer. The medic then finds an artery and inserts the opposite hypodermic into the artery and allows blood to fill and flow through the device. Once blood has filled the device and blood flow is confirmed out of the needle in the vacutainer, the medic constricts the line to stop the blood flow. The vacutainer is used not only to confirm blood flow, but also to contain infected blood. The device is bidirectional, so it doesn't matter which needle is inserted into the vacutainer and which is inserted into the artery. The medic then finds a vein and checks that there is no air in the lines and no clots before removing the hypodermic from a vacutainer and inserting it into a vein. After the medic inserts the needle into the vein, he will then release the constricted line and allow blood to flow. There will have to be an anticoagulant drug in the device because you can't realistically expect a medic to complete the insertion procedure in under 10 seconds, which is the average time blood starts to clot. If blood clots in the device, not only will it block the blood flow, it will also ruin the device. The anticoagulant is only needed for the needle insertion procedure and is not necessary for damaging virus particles. Blood is allowed to flow through the device for 30 minutes. That is the time based on the results of phase 1 testing and could change based on the results of phase 2 and phase 3 tests. After 30 minutes, the medic constricts the line to stop the blood flow or removes the hypodermic from the vein, and it reinserts it into the vacutainer. The hypodermic on the artery side is then removed. If the AVD is planned on being used again, saline would be flushed through the device to remove any blood. As with syringes, the AVD should only be reused on the same patient and not on multiple patients. It should also be disposed of the same as a syringe. And that is how the AVD works.